good day everyone, I am Myla Tracy Cantaha and today we're going to talk about breast and lymphatics assessment. The breast is the tissue overlying the chest or the pectoral muscles. Women's breasts are made up of specialized tissue that produces milk or the glandular tissue, as well as fatty tissue. The amount of fat determines the size of the breast. Lymph nodes. The anterior nodes drain the anterior chest wall and breast. The posterior chest wall and the part of the arms are drained by the posterior nodes. The lateral nodes drain most of the arms and the central nodes receive drainage from the anterior, posterior, and lateral lymph nodes. Assessment. For purposes of describing the location of assessment findings, the breasts are divided into 4 quadrants. The upper quadrant, which extends into the axillary area, is referred to as the tail of Spence. Most breast tumors occurs in this quadrant. These are the 4 quadrants of the breast called the upper outer quadrant, lower outer quadrant, upper inner quadrant, and lower inner quadrant, and also the axillary tail of Spence, or what we call the locations where lymph nodes were found. Nursing assessment. The purpose of breast and lymphatic nursing assessment is to identify signs of breast disease and initiative early treatment. It incorporates the recognition of normal versus abnormal physiology of the breast and lymphatics, which prompt recognition of pertinent changes along with the skill of critical thinking that allows the nurse to identify and prioritize appropriate interventions. The equipments that we're going to be needing in performing this assessment are centimeter ruler, small pillow, gloves, and the client handout for BSE, and slide for specimen. Breast awareness and self-examination. Number 1. Lie down with your right arm behind your head. Lying down spreads the breast tissue evenly over the chest wall, making it easier to feel. Number 2. Use the 3 middle finger pads of your left hand to feel for any right breast lumps, using overlapping small or dime-sized circular motions to feel breast tissue. Number 3. Use light pressure to feel the tissue closest to the skin, medium pressure to feel deeper, and firm pressure to feel the tissue closest to the chest and ribs. Number 4. Move in an up and down pattern, then to the breast, to the middle chest bone, neck, and ribs. The up and down vertical pattern is most effective for covering the entire breast. Repeat for the right side. Number 5. Stand in front of a mirror and press your hands firmly down on your hips. This contracts chest wall muscles and emphasizes any breast changes. At the same time, look at your breast for changes in size, shape, or contour. Note any dimpling, redness, or scaliness of the nipple or breast skin. Number 6. Examine both underarms while sitting up or standing with your arms slightly raised. Do not raise your arms straight up because it will tighten the breast tissue, making it difficult to examine. The preparatory phase. Number 1. Reassess client's previous medical records if available. Number 2. Determine the scope of assessment needed for the assessment. Prepare the necessary equipment. Number 3. Perform hand washing, don gloves if deemed necessary, and warm your hands. Number 4. Introduce yourself and verify the client's identity. Number 5. Explain the procedure to the client and ask the client's permission while doing the assessment. Number 6. Position patient comfortably and provide privacy. Questions may include in the assessment: lumps or swelling in breast or in the underarm area, redness, warp, or dimpling in breast disease, breast surgery, breast biopsy, breast implants, or breast trauma, menstruation, family background of breast cancer, and lifestyle and health practices. Breast assessment inspection. Number 1. Inspect the breast for size, symmetry, and contour or shape while the client is in sitting position. Have the client disrobe and sit with arms hanging freely. Number 2. Inspect the skin of the breast for localized discolorations or hyperpigmentation, retraction, or dimpling. Localized hypervascular areas, swelling, or edema. Be sure to note client's overall skin tone when inspecting the breast skin. Note any lesions. Number 3, inspect the areolas. Note the color, size, shape, and texture of the areolas of both breasts. Number 4, inspect the nipples. Note the size and direction of the nipples of both breasts. Also, note any dryness, lesions, bleeding, or discharge. Number 5, inspect the nipples for size, shape, position, color, discharge, and lesions. Number 6, inspect for retraction and dimpling. Breast assessment palpation. Palpate the axillary, subclavicular, and supraclavicular. Palpate the nipples. Press the nipples gently with your thumb and index finger. The axillae, inspection and palpation. Number 9. Inspect and palpate the axillae. Inspect the axillary skin for rashes or infection. Palpation pattern into the axillae, ribs, posterior axillae, anterior axillae, inner aspect of upper arm. Determination phase. Number 10. Review the information obtained during the assessment phase and discuss findings to the client. Present to the client possible plans to resolve health concern if present. Number 11. Measure client's understanding of the plan and the need for further teaching. Provide the client opportunity to clarify, ask, or raise any concern to the assessment. Number 12. End the interview politely. Number 13, validate and document the findings. Validate the breast and lymph node assessment data you have collected. This is necessary to verify that the data are reliable and accurate. Document the assessment data following the healthcare facility or agency policy. And that ends my discussion for the breast and lymphatics assessment. I hope you learned something. Bye!